Imagine waking up one morning, and as you try to get out of bed, a sharp, burning pain shoots down your leg like lightning. You can't stand up straight. Every movement feels like torture. You think maybe you slept wrong, but days pass, and the pain only gets worse. Sound familiar? Well, you might be dealing with one of the most common yet misunderstood spinal conditions, a herniated disc, or as many people call it, a slipped disc. Hello everyone, I'm Dr. Elizabeth, and today we're diving deep into the world of herniated discs. Did you know that approximately 2% of the global population experiences a herniated disc each year? That's roughly 156 million people worldwide. And here's the scary part, while many cases resolve on their own, some can lead to permanent nerve damage if left untreated. But don't panic just yet, because by the end of this video, you'll know exactly what a herniated disc is, how to recognize it, what causes it, and most importantly, how to treat it naturally and medically. So grab your notepad, get comfortable, and let's talk about your spine, because trust me, after watching this video, you'll never take those little cushions between your vertebrae for granted again. Let's start with the basics. Your spine isn't just one solid piece of bone, it's actually made up of 33 individual bones called vertebrae, stacked on top of each other like a tower of building blocks. Now, between each of these vertebrae, there are soft, rubbery cushions called intervertebral discs. Think of them as little jelly donuts sitting between your bones. These discs have two parts, a tough outer layer called the annulus fibrosus, fancy name, I know, and a soft, gel-like center called the nucleus pulposus. The job of these discs is crucial, they act as shock absorbers for your spine, allowing you to bend, twist, and move without your bones grinding against each other. Now, a herniated disc occurs when that tough outer layer develops a tear or weakness, and the soft gel-like center pushes through, kind of like squeezing a jelly donut and watching the filling ooze out. When this happens, that protruding material can press on nearby nerves, causing pain, numbness, tingling, and weakness. The most common location for herniated discs is in the lower back, specifically the lumbar spine, which is why we often call it a lumbar disc herniation or simply back hernia. The second most common area is the neck or cervical spine. The thoracic spine, that's your mid-back, rarely experiences herniated discs because it's more stable and less mobile. You might be wondering, Dr. Elizabeth, why does this happen to some people and not others? Well, let me break down the main culprits. Age-related degeneration. As we age, our discs lose water content, they literally dry out. This process, called disc degeneration, makes the discs less flexible and more prone to tearing. Most herniated discs occur in people between 30 and 50 years old, though it can happen at any age. Improper lifting, this is a big one. Lifting heavy objects using your back muscles instead of your legs puts enormous strain on your lower spine. I've seen countless patients who herniated a disc while moving furniture or lifting boxes the wrong way. And sometimes, it's not even a heavy object, just lifting something small with a twisting motion can do it. Repetitive strain, jobs or activities that involve repetitive bending, twisting, or heavy lifting can gradually wear down the discs over time. Construction workers, nurses, warehouse employees, these folks are at higher risk. Sudden trauma, a fall, car accident, or sports injury can cause immediate disc herniation. The force can be so sudden that the disc simply can't handle the pressure. Obesity, excess body weight puts additional stress on the discs in your lower back. Studies show that people with a BMI over 30 are significantly more likely to develop herniated discs. Genetics, some people are simply born with a genetic predisposition to weaker disc material. If your parents had disc problems, you might be more susceptible too. Sedentary lifestyle, ironically, not moving enough can be just as bad as moving too much. Weak core muscles fail to support your spine properly, putting extra stress on the discs. Smoking, yes, smoking. Nicotine reduces blood flow to the discs, accelerating the degeneration process. Smokers are at a much higher risk for herniated discs. Now, let's talk about symptoms, because recognizing them early can make all the difference in your recovery. The classic sign, sciatica, this is the big one. When a herniated disc in your lower back presses on the sciatic nerve, you get what we call sciatica, a sharp, shooting pain that travels from your lower back down through your buttock and into your leg, sometimes all the way to your foot. Patients describe it as electric, burning, or like a hot poker running down their leg. And here's the thing, it's usually worse in one leg than the other. Lower back pain, you might experience localized pain in your lower back, but here's something interesting, some people with herniated discs have minimal back pain and mostly leg pain. The opposite can also be true. Numbness and tingling, you might feel pins and needles, or a numb sensation in your leg, foot, or toes. This happens because the compressed nerve isn't transmitting signals properly. Muscle weakness, the affected leg might feel weak. You might have trouble standing on your tiptoes or lifting your foot upward. Some patients tell me they suddenly start tripping over things because their foot drops. Pain that worsens with activity, sitting, coughing, sneezing, or laughing can all make the pain worse because these activities increase pressure in your spinal canal. Many patients can't sit for more than 15 to 20 minutes without excruciating pain. Relief when lying down, most people feel better when lying down because it takes pressure off the disc and nerves. Bladder or bowel dysfunction, now, this is rare but serious. If you suddenly lose control of your bladder or bowels, or experience numbness in the saddle area, that's your inner thighs and buttocks, get to an emergency room immediately. This could be cauda equina syndrome, a medical emergency requiring immediate surgery. When you come to see me with these symptoms, here's what I do. First, I'll take a detailed medical history and perform a physical examination. I'll test your reflexes, muscle strength, walking ability, and sensitivity to touch. There's a classic test called the straight leg raise test. I'll have you lie on your back and lift your leg while keeping it straight. If this reproduces your leg pain, it's a strong indicator of a herniated disc. But to confirm the diagnosis, we usually need imaging. MRI, magnetic resonance imaging. This is the gold standard. It shows soft tissues, including discs and nerves, in incredible detail. It can show exactly which disc is herniated and how severely it's pressing on nerves. CT scan, sometimes used instead of or in addition to MRI. It provides good detail but uses radiation. X-rays, these won't show the herniated disc itself, because discs are soft tissue, but they can rule out other problems like fractures or arthritis. EMG, electromyography. This test measures the electrical activity in your muscles and can determine which nerve root is being compressed. Let me share some eye-opening statistics with you. Herniated discs affect approximately 1 to 3% of the population annually, with a lifetime prevalence of about 20%. That means 1 in 5 people will experience this at some point in their lives. The condition is most common in people aged 30 to 50, with men being twice as likely as women to develop it. Interestingly, about 90% of cases involve the L4, L5 or L5S1 discs. These are the 2 lowest discs in your lumbar spine. Now, here's the good news. Most herniated discs improve on their own within 6 weeks to 6 months. Only about 10% of cases require surgery. However, if left untreated and the nerve compression is severe, you could develop permanent nerve damage, chronic pain, or loss of function. The mortality rate from herniated discs themselves is essentially zero. You won't die from a herniated disc. But the disability rate is significant. Herniated discs are one of the leading causes of work disability in adults under 45 years old, costing billions in lost productivity and healthcare expenses globally. Let's talk about medical treatment options. When you come to see me with a herniated disc, here's what I might prescribe. NSAIDs, nonsteroidal anti-inflammatory drugs. Medications like ibuprofen, Advil, Motrin, or naproxen, Aleve, work by blocking enzymes called COX-1 and COX-2, which produce prostaglandins, chemicals that cause inflammation and pain. By reducing inflammation around the compressed nerve, we can significantly reduce your pain. Muscle relaxants, medications like cyclobenzaprine, Flexeril, or methocarbamol, Robaxin, work on your central nervous system to reduce muscle spasms that often accompany disc herniation. Your body naturally tenses up around an injury, but this muscle guarding can actually make things worse. Oral steroids, short courses of prednisone or methylprednisolone, can provide powerful anti-inflammatory effects. These work by suppressing your immune system's inflammatory response. Neuropathic pain medications, drugs like gabapentin, Neurontin, or pregabalin, Lyrica, were originally developed for epilepsy, but they work wonderfully for nerve pain. They calm down overactive nerve signals. Opioid pain relievers. For severe, short-term pain, we might prescribe medications like tramadol or oxycodone. But I'm always cautious with these due to addiction risks. They work by binding to opioid receptors in your brain and spinal cord, changing how you perceive pain. Epidural steroid injections. This is when we inject corticosteroids directly into the epidural space around your spinal cord. It delivers powerful anti-inflammatory medication right where you need it. About 50% of patients get significant relief from these injections. This is the question everyone asks me, Dr. Elizabeth, when will I be back to normal? The answer varies, but here's what research shows. Acute phase, 0 to 6 weeks. Most patients experience the worst pain during the first 2 to 4 weeks. With proper treatment and rest, about 50% of patients feel significantly better by 6 weeks. Subacute phase, 6 weeks, 3 months. During this period, the body's natural healing processes really kick in. The herniated material can actually shrink as your body reabsorbs it. About 70 to 80% of patients are much improved by 3 months. Chronic phase, 3 to 6 months. By 6 months, approximately 90% of patients have recovered sufficiently to return to normal activities. However, some factors can slow healing: smoking, obesity, physically demanding jobs, severe initial herniation, and age over 50. Now we're getting to my favorite part: natural healing methods. I'm a big believer in empowering your body's natural healing abilities. Here's what actually works. Ice and heat therapy. In the first 48 to 72 hours, use ice for 15 to 20 minutes every few hours to reduce inflammation. After that, switch to heat to improve blood flow and relax muscles. Simple, effective, and free. Gentle movement and walking. I know it hurts, but complete bed rest for more than 1 to 2 days actually slows healing. Short, gentle walks help maintain blood flow and prevent muscle atrophy. Start with 5 to 10 minutes several times daily. Physical therapy. This is crucial. A good physical therapist will teach you exercises to strengthen your core muscles, improve flexibility, and correct posture. The McKenzie method, in particular, has shown excellent results for disc herniation. Swimming and water therapy. The buoyancy of water takes pressure off your spine while allowing you to move and strengthen muscles. It's one of the best exercises for herniated discs. Yoga and stretching. Gentle yoga poses, especially those that promote spinal extension, can help. The cobra pose, cat-cow stretch, and child's pose are particularly beneficial. But avoid extreme forward bending. Anti-inflammatory diet. Foods rich in omega-3 fatty acids, salmon, walnuts, flax seeds, berries, leafy greens, and turmeric can help reduce inflammation naturally. Avoid processed foods, excess sugar, and trans fats that promote inflammation. Proper posture. This is huge. Learn to sit, stand, and sleep with proper spinal alignment. When sitting, use a lumbar support cushion. When sleeping, try lying on your side with a pillow between your knees, or on your back with a pillow under your knees. Weight management. If you're overweight, losing even 10 pounds can significantly reduce pressure on your lower spine. Acupuncture. While the mechanism isn't fully understood, many patients report significant pain relief from acupuncture treatments. Some studies suggest it helps by releasing natural pain-relieving chemicals in your body. Massage therapy. Therapeutic massage can help reduce muscle tension and improve circulation, though it won't fix the herniated disc itself. Inversion therapy. Using an inversion table allows gravity to gently decompress your spine. Some patients swear by it, though always consult with your doctor first. You're not alone in this struggle. Many famous people have dealt with herniated discs. Tiger Woods, the golf legend, has had multiple back surgeries for herniated discs and even underwent spinal fusion surgery. Despite this, he made an incredible comeback to win the Masters in 2019. George W. Bush, the former U.S. president, underwent surgery for a herniated disc in his lower back in 2007 while still in office. Dwight Howard, the NBA star, has openly discussed his struggles with herniated discs and how they affected his basketball career. Joe Rogan, the podcast host and UFC commentator, has talked extensively about his herniated disc issues and his journey to recovery through stem cell therapy and physical therapy. These stories show that herniated discs can affect anyone, regardless of fitness level or profession. But they also show that recovery is absolutely possible. The history of herniated disc treatment is fascinating. For most of human history, severe back pain was poorly understood and often attributed to kidney problems or rheumatism. It wasn't until 1934 that two neurosurgeons, William Jason Mixter and Joseph Seton Barr, first described the herniated disc as a cause of sciatica in their groundbreaking paper published in the New England Journal of Medicine. This was revolutionary. Before this, many patients with herniated discs were labeled as having psychological problems or hysteria. In the early days, treatment was limited to bed rest, traction, and eventually, surgery. The first successful disc removal surgery, discectomy, was performed in the 1930s, but it was highly invasive. In the 1960s, Dr. Lyman Smith introduced chymopapain injections using an enzyme from papaya to dissolve herniated disc material. This was used until the 1990s but had significant complications. The 1970s brought us the CT scan, and the 1980s gave us MRI technology, allowing doctors to see herniated discs clearly for the first time without surgery. In 1985, Dr. Pervez Kambin pioneered endoscopic spine surgery, leading to today's minimally invasive procedures. Now, many disc surgeries can be done through tiny incisions with faster recovery times. More recently, we've seen innovations like artificial disc replacement, laser disc surgery, and even stem cell therapy. The field continues to evolve rapidly. Listen carefully, because these mistakes can seriously set back your recovery. Don't rest too much. More than 1 to 2 days of complete bed rest actually weakens your muscles and slows healing. Keep moving gently. Don't ignore red flag symptoms. If you experience loss of bladder/bowel control, severe weakness, or saddle numbness, don't wait, go to the emergency room immediately. Don't smoke. Smoking reduces blood flow to your discs and significantly slows healing. If you smoke, this is your wake-up call to quit. Don't lift heavy objects. Avoid lifting anything over 10 pounds during the acute phase. And when you do lift, always use proper technique, bend your knees, not your back. Don't sit for long periods. Sitting puts 40% more pressure on your discs than standing. Set a timer to stand and move every 20 to 30 minutes. Don't do high-impact exercises. Avoid running, jumping, or contact sports during recovery. These can worsen the herniation. Don't sleep on your stomach. This position hyperextends your spine and can worsen symptoms. Stick to back or side sleeping with proper pillow support. Don't self-diagnose and ignore medical help. While many cases resolve on their own, you need proper diagnosis to rule out serious complications. Now for the good stuff: actions that will speed your recovery. Start gentle core strengthening. Once the acute pain subsides, begin exercises to strengthen your abdominal and back muscles. A strong core is your spine's best friend. Maintain proper ergonomics. Set up your workspace correctly. Monitor at eye level, feet flat on floor, lumbar support in place. Stay hydrated. Your discs are mostly water. Drinking plenty of water helps maintain disc height and health. Follow your treatment plan, whether it's physical therapy, medications, or exercises. Consistency is key. Don't skip sessions. Practice mindfulness and stress reduction. Chronic pain and stress create a vicious cycle. Meditation, deep breathing, and relaxation techniques can help break it. Modify your activities. Learn to adapt daily activities to protect your spine. Use a reacher for picking things up. Push instead of pull when possible. Be patient. Healing takes time. Don't rush back to full activity too quickly or you risk re-injury. Once you've recovered, the goal is to prevent recurrence. Here's your long-term plan. Continue core exercises. Make core strengthening a permanent part of your routine. Even just 10 to 15 minutes 3 times a week can make a huge difference. Maintain a healthy weight, keep those extra pounds off to reduce stress on your spine. Practice proper body mechanics, always lift with your legs, not your back. Make this an automatic habit. Stay active, regular exercise, especially low-impact activities like swimming, walking, and cycling, keeps your spine healthy. Ergonomic awareness, whether at work or home, maintain good ergonomics in everything you do. Annual checkups, even if you feel fine, regular checkups with your doctor can catch problems early. Listen to your body, if you feel that familiar twinge, don't ignore it. Address it early before it becomes a full-blown herniation again. Now, here's something interesting: there aren't specific blood tests that diagnose a herniated disc. However, your doctor might order certain blood tests to rule out other conditions or check for complications. Complete blood count, CBC, to rule out infections if you have fever along with back pain. Erythrocyte sedimentation rate, ESR, and C-reactive protein, CRP. These inflammatory markers can help rule out inflammatory conditions like ankylosing spondylitis or infections. Rheumatoid factor and anti-CCP, to rule out rheumatoid arthritis if symptoms are unclear. The diagnosis of herniated disc relies primarily on clinical examination and imaging, MRI, not blood tests. So there you have it, everything you need to know about herniated discs. From the moment that jelly-like nucleus pulposus pushes through your disc's tough exterior, to the journey of healing and recovery. Remember, a herniated disc diagnosis isn't a life sentence. Yes, it's painful. Yes, it can be scary. But with proper treatment, patience, and dedication to your recovery, the vast majority of people get better and return to their normal lives. Your spine has carried you through life, supporting every movement, every activity. Now it needs your support in return. Whether you're currently dealing with a herniated disc, recovering from one, or trying to prevent one, the knowledge you gained today is power. Take care of your spine, listen to your body, and don't hesitate to seek medical help when you need it. Your future self will thank you. I'm Dr. Elizabeth, and I'll see you in the next video where we'll explore another fascinating health topic. Until then, stand tall, move wisely, and remember, your health is your greatest wealth.